Hey everybody, Pete Williams here. Did you know that actually using mouthwash, particularly mouthwashes, may increase our risk of cardiovascular disease? How the hell does that happen? Well, in 2014, a group of researchers based here in London actually wanted to look at mouthwashes, and in particular mouthwashes that contained a chemical substance called chlorhexidine. And what did they find? Is that they found that actually chlorhexidine had a small but significant risk on raising our blood pressure. Well, how the hell does it do that? Well, what we've gone on to find, and of course, as you know, the medical literature is full of all the research with regards to their gastrointestinal microbiome, but more and more we're looking at the oral microbiome as well, and the bacteria that reside in our throats and around our oral cavities. So what did they find? Well, interestingly, they found that there are four subspecies of bacteria that reside on the back of our tongue. So what? Well, when you are using a mouthwash with chlorhexidine, it wipes them out. And what we're finding, aren't we, that these bacteria have generally really good jobs to do for the body, because we sort of coexist with them. And one of the roles of these bacteria on the third of the back of the tongue is to convert dietary nitrates. And these are compounds that come from beetroots or brassica vegetables or salad leaves, in particular rocket. And the bacteria convert these nitrates into nitrites, which are eventually made in the body to nitric oxide. So what? Well, what we know from nitric oxide is that it becomes a vasodilating substance for our vascular system. In other words, it reduces our blood pressure, and therefore the consistent use of mouthwashes that contain chlorhexidine reduces our ability to lower our blood pressure through constant use. So, what does it mean? Well, how do we translate that to day to day? Well, if you have a patient or yourself are at risk from higher blood pressure and you're using mouthwash that contains chlorhexidine, then maybe that's something that you really need to consider to stop. In the meantime, maybe we should look at different ways that we're trying to freshen our breath or clean our teeth rather than the swig of the mouthwash. So there you go. I'm Pete Williams. I'm trying to translate the sometimes difficult science into simple messages, and I will see you soon.